Hi friends, I'm back with another session here. In this video we will be discussing about nephrotic syndrome. Nephrotic syndrome is characterized by proteinuria, peripheral edema, hypoalbuminemia and hypercholesterolemia. So these are included in the tetrad of nephrotic syndrome. Now coming to nephrotic syndrome causes. First of all, you can see here there is a sick kidney, and this is container containing a urine having protein in this. So the sick kidney is saying, sorry, I keep spilling all of these protein, I hope that doesn't cause any other problems. So the sick kidney is hoping all this. Now coming to causes are minimal change disease, focal segmental glomerulosclerosis, membranous nephropathy, diabetes, systemic lupus erythematosus, amyloidosis, blood clot, and heart attack. Now, this is pathophysio of nephrotic syndrome. So here you can see there is inflammation and damage. Here you can see inflammation damage. So inflammation is from the immune cells, antibody, complement protein, immune complexes, maybe hypertension or sclerosis. Any of the reason can be there to cause this inflammation. Inflammation makes these capillaries leaky, because of which the protein leaks out into the nephron, and from here the protein is going out through the collecting tubule out into the urine. So there is proteinuria, there is loss of protein in nephrotic syndrome, which is more than 3.5 gram per 24 hour. Now proteinuria is very massive, it is a mass proteinuria, and as immunoglobulins are also antibodies, so loss of immunoglobulins will increases the risk of infection. And there is hematuria sometimes. Hematuria depends on how much damage occurs in glomeruli. Now because of this mass proteinuria or massive proteinuria, there will be hypoalbuminemia. Here you can see hypoalbuminemia in the vessels, because of which our body says the liver to produce more albumin to compensate this loss, and as a result liver started producing albumin and also cholesterol, so leading to hypercholesterolemia. Now because of this hypoalbuminemia, there is decreased plasma oncotic pressure, because of which water and electrolyte diffuse into the interstitium. As because of no solutes and proteins in the vascular compartment which will hold the water and electrolytes, so fluid shift from the circulation into the interstitium, leading to edema. And also because of this shift into the interstitium, there is less fluid in the vessels, so there is a decrease in venous return to the heart, decreasing the volume in vascular compartment can decreases the blood flow too, and heart will not able to pump out the blood effectively, whatever the need of the body, according to need of body. So there will be decreased renal blood flow and decreased GFR. This decrease will stimulate some cells at the head of the nephron to produce a molecule called renin, and this renin activates the RAS system, that is renin angiotensinogen aldosterone system. And as we all know, the most important function of RAS is to increase blood pressure to compensate decrease in blood volume and increase GFR. So to fulfill its purpose, it causes retention of water and sodium, and hence edema occurs again. So this is what pathophysiology.